You can promote anyone that you want.
Yes, I'm waiting for their name to pop up.
Okay.
Hi everyone, thanks for joining. Just give us a couple of minutes to get everything set up, and then we'll get started right away. Thank you for your patience. Hi everyone, if you're just coming in from the waiting room, we're getting some things set up and we will begin shortly. Thank you.
Good morning. Can you hear us?
Yes, we can hear you.
Okay. The link's working. Thank you.
Okay, thank you. All right, everyone, thanks for your patience. We're going to go ahead and begin today's Lunch and Learn. I'm going to go ahead and pass it over to Stephen first, who will introduce today's webinar.
Hello. Well, good afternoon, everybody. My name is Stephen Barnes. I'm the Executive Director of the Kathleen Blanco Public Policy Center at the University of Louisiana at Lafayette. And we're excited to welcome you to our 11th Lunch and Learn for Whole Health Louisiana. Whole Health Louisiana is a collaborative effort led by the Louisiana Department of Health as the public sector anchor and funder for the Whole Health Louisiana initiative. And the Blanco Center leads the plan's implementation and evaluation. If you're unfamiliar with what Whole Health Louisiana is, it's the state's cross-sector initiative intended to systematically address, mitigate, and prevent childhood adversity within our systems of care and support. Whole Health Louisiana has four priority areas and goals: collaboration, awareness, workforce, and prevention and healing. With these priorities in mind, Whole Health Louisiana's vision is to build a state where children, families, and community members across Louisiana are healthy and thriving, regardless of who they are or where they live. And before I turn it back over to Quinn, I do want to just highlight how excited I am to hear our speaker today, Secretary Matlock. I've had the pleasure and opportunity to hear him talk about the importance of trauma-informed care, and there may be no greater champion for this sort of initiative in Louisiana. So excited about today's presentation, but I'll hand it back over to Quinn from our team for a full introduction to our speaker today.
Thanks, Stephen. So, hi, everyone. Like Stephen mentioned, I'm Quinn. I'm a research associate here at the Blanco Center, and I am the coordinator for the Whole Health Louisiana project. And I will be moderating today's Lunch and Learn webinar and all of our future Lunch and Learn webinars. So as a part of this initiative, we are holding a variety of different activities meant to raise awareness and deepen conversation about trauma-informed care practices. Our virtual Lunch and Learn series touches on the workforce priority area of the Whole Health Louisiana Plan and features presentations from industry professionals and subject matter experts. Due to the popularity of the series, we're continuing up until December. We are focusing on trauma-informed care in specific workplaces, and we're so happy and excited to have Secretary Matlock start us off with this season's series. So our planned webinars are all listed on the Eventbrite page that you all use to register for today's events. If you want to learn more about next month's webinar, then you can read it on our Eventbrite page. So before I introduce our speaker for today, I want to mention our ASL interpreter is pinned at the top of the screen. So you should be able to see her interpretation throughout today's webinar. If you're having any issues viewing that, please do let us know. In addition, if you are attending for CEU credits, please do remember to fill out the CE credit request form and complete the post survey to receive your credits. Okay, with all of that, I'm going to go ahead and introduce our speaker for today, Secretary Matlock, who is currently serving as the Secretary for the Department of Children and Family Services, where he was appointed in January of 2024. Matlock previously served as Chief Judge of the Juvenile Court for Caddo Parish from 1999 until his retirement in June of 2023. Matlock played a pivotal role in moving the court to a trauma-informed care approach focused on addressing childhood trauma and mitigating intergenerational trauma, During his tenure, the juvenile court had the state's first juvenile drug court, family drug court, juvenile mental health court, and truancy court. He also saw the development of the state's first sex trafficking community response team and specialized victims intensive unit. He has been recognized for his commitment to Louisiana's youth, including by receiving the Volunteers for Youth Justice Hero of the Year Award in 2019, the Louisiana CASA Judge of the Year in 2005 and 2019, and the Volunteers for Youth Justice Shining Star Legal Advocate in 2008. As well as the Together We Can.
I think I'm unmuted now, Gwen. Thank you. That's quite enough about me, honestly. Too much, actually. I'm incredibly grateful. Thank you to Whole Health Louisiana, and also thank you to LDH for inviting me to speak today. I'm honestly more excited about this speech than any speech I have made, I believe, in the last year and a half. So, and it's going to be a little bit different, I'm going to tell you, and it's particularly honored honoring to me. I'm grateful for being able to kick off this second year. I want to emphasize two things today. One is all real trauma work in this state is local. That's where and by the way, for Lisa, I'll apologize in advance, but I do want to say, to give her a chance to tell others, I have a hick accent from Manny. And so now that she's telling you that will help. I don't know how that's handled. And perhaps I was politically or somehow culturally incorrect for doing that, but I am what I am. And again, grateful. All effective trauma work is local, and that's where we will change as a state. And I'm incredibly grateful for the state level work. That is how you get it done. But the actual change is going to happen in Manny, in Shreveport, in Bogalusa, in Tallulah, in Monroe, in Ruston, in Minden, in Lake Charles, in Lafayette, in the Florida parishes, in the Crescent City. the Big Easy, in Acadiana. That's where the change is going to be. And it's going to be local people working with local leaders and local providers to tear down silos and change the way our state does things. So we can provide a matrix statewide, but the actual change is going to happen in local communities. And we need to, that's where we need individually to commit our efforts. Child welfare, the child welfare office, every child we serve in the child welfare office is affected by trauma. Many of them deeply, deeply affected by trauma. And trauma is fundamentally a health problem. It's related to education, it's related to poverty, it's related to employment, it's related to housing, it's related to adverse and positive outcomes, but fundamentally it is a health problem. And that's why the work of the Office of Public Health, the Office of Behavioral Health, the Office of Medicaid, and the Office of Child Welfare are working within one body of work. And that needs to be emphasized. Child welfare is a body of health work. It's a particular body. It's a peculiar body. It largely deals with the residencing of services, but it also deals with bringing those services to children in their home of origin. You know, a lot of people equate child welfare with foster care. Those are two different things. And child maltreatment is a much broader thing than foster care. Now, I love foster parents. My heart comes into this work because of foster children, foster parents, and biological parents. But I want to recognize that if we don't braid this in and allow ourselves to be led by medical professionals, and I'm not limiting that, of course, to medical doctors. I'm limiting it, health care writ large. In our local communities in Shreveport, as we were building up this work, we turned to the primary care physicians, family doctors, OBGYNs, pediatricians, and certainly those involved in neurology and psychiatry. And as we move outward from what we would kind of consider physical health into psychology and other disciplines and areas, and certainly counseling and social work. But we've got to work together as an agency. I love Secretary Bruce Greenstein. He is a brilliant man and a professional man, an operational genius. I'm not. I'm a mom and pop guy. I came from up through a litigator, oil and gas law, commercial litigation, savings and loans and injured folks. I was blessed and fortunate and excited enough to get to work for close to 30 years in child welfare and in that body of work. And that is where my heart is. But I'm not a graduate of the Wharton School of Business. I'm a graduate of the Baylor School of Law. And my training comes into that. But we got to recognize that at its core, trauma is a health issue. It affects, we all know, chronic disease. The experts in obesity have known this for well over a decade, and really going into the 90s as the Kaiser Permanente work came out, study. The Body Keeps the Score began, out of that sort of body, the author, and that sort of transformational cross from clinical work into popular culture. and the realizations that arose from that work early in the 90s, Kaiser, through everything going on today. But we, as a state and ultimately and practically as local communities, have to understand the medical need behind this. And what I'm telling you is, as a child welfare person, we need that leadership. We're willing partners, and we'll lead. You know, it's in folks, in my introduction, it's embarrassing because all I happened to be was at the right place with the right group of leaders, and got credit for a ton of things that other people, other visionaries, other professionals, other scientists did. And that, you know, there's value to that. I could call a meeting, you know, a robe lets you do that. And that is not something to take lightly. I'll be meeting with the judges Friday morning here from around the state, some of the judges, and I intend to emphasize that. But doctors, other medical professionals, nurse practitioners, social workers, LPCs, educators, others. Now, so I've talked about that, and it's the important, the takeaway there is tear down the silos. Don't settle for the barriers and the walls between departments, between agencies, between disciplines, between domains. Cross over and be willing to work collaboratively and be willing to learn. And to our doctors and to other medical professionals, lead. We'll follow. And we'll bring people to the room, but we need you. We need public health. We need behavioral health. We need all, and then, you know, criminal justice, education, juvenile justice, certainly, and all these other domains that begin coming in, and workforce development. Well, I don't want to go forward without saying that it's integrally related to this, and health is a driver of employment. And, you know, it's often quoted, the best social program is a job. And we have a new day where we're emphasizing not doorways or even one door into welfare. It is one door and doorways into what old school folks like me call the American dream. The idea of having a fulfilling, healthy, rewarding life, serving others or helping others, and having the psychic rewards that come from that. So yes, employment is a huge part of this. The one-door work that we're engaged in right now with our amazing partner, Department of Health, to bring the eligibility for SNAP benefits and other public welfare benefits, associating it with Medicaid, because the Venn diagram overlaps so tremendously, and ultimately helps stabilize families. So sorry for that seeming disjointedness there, but it is all related, and trauma is the thread. Childhood trauma, unresolved childhood trauma, unresolved relational, chronic childhood trauma is the thread that runs through so much stuff. And if anybody questions that, let's get in my truck and ride to Angola and go to Camp J and talk to the folks there and ask them about their childhoods, or go into emergency rooms, juvenile courtrooms, classrooms, and we will find we all share that in common. Clinics, and the deep end work of mental health, but also the shallower ends of the pool. And ultimately, I hate to keep harping on trauma because the real subject matter is resilience. And that's the big pathway out. And it involves evidence-based, Medicaid-funded, trauma-informed, and trauma-responsive modalities when we're talking about treatment, EMDR, TFCBT, when in the interventive and preventive type work of TBRI, trust-based relational intervention, which, you know, special to my heart because it's so deeply ingrained with parenting, but really caretaking. And I guess the real point I want to make about that and also bringing it local is addressing this at a population level. And I hate to say that because that almost draws one to want to envision billboards and mass media. No, it's got to be done local. It's ultimately one child, one family, one community is where the work builds out. You know, it reaches to the state, but it starts there. But at that population level, what I'm referring to there is the education for the actual caregivers for parents. There was a time when judges had trauma training. I've started to use a lot of it. Teachers, law enforcement, certainly clinicians, behavioral health folks, doctors. Shreveport Medical School has done such an amazing job of LSU there of integrating grand rounds and trauma into their well checks for pediatric work. But it builds out from there because it's really, go back a step for pediatrics. It's OBGYN, you know, a lot of this stuff is driven through the unresolved childhood trauma of mama, and that manifesting itself in the behavioral health that we're seeing or that we see. And in lifestyle issues that drive this. It's hard to maintain a family without multiple incomes in today's society. Good or bad, whatever, but facts are facts. It is hard. And my phone, my emails, my texts, and by the way, my email is david.matlock@la.gov. My cell number is 225-335-6283. And I'm happy for anybody that wants to post that in the chat to do so. But because I put that out there, I get, you know, requests for help with SNAP, with child support, with child welfare, from bio parents, from foster parents, from CASAs, from judges, well, not judges, but others. So I can tell you it's hard making it today. And looking at the horizon, does anybody in this feel like it's getting a whole lot easier soon? I feel like, and I don't know if it's temporary or other, but I feel a reduction in some of the substance use issues we see. I'm not happy about gummies, I will tell you. Putting a psychoactive element of some kind in a package that looks like something enticing for a toddler, it ain't no way to live. And, you know, we need to come together and address that. That's a separate matter. Sorry for my little pulpit on that. But is there a way of addressing questions or chat questions in this? Or practically, if you're a community, and let me speak to some of the work being done in Baton Rouge. A fellow named Norman Elrod, counselor, some other folks there working around him. George Mills with Extra Mile, great leader, kind of lives in the Baton Rouge area and works in Lafayette with Extra Mile. They're pulling together and saying, we want a trauma-informed community in Baton Rouge. And they're making plans, I think, along with some of the help leaders with Blanco and public health, Ms. Lowbray and others, Dr. Lowbray. Should be if she's not. To have a summit in Baton Rouge. The mayor's interested, others, just around trauma, and say, all right, let's do this. It's local. Let's be a community. Shreveport's done that so well. You know, if you want to know who to call Volunteers for Youth Justice. Call Kelly Todd, Lucinda Miles, Cretia Bennett, any of the amazing leaders up there with Volunteers for Youth Justice. One of our high-level folks here in Baton Rouge, I visited with them this morning. They were there yesterday. They were just blown away by the harbor. One-stop shop, all of the stuff, calming studio, mental health, child support, food pantry, foster closet, school-based behavioral stuff based there, wraparound services, CSOC services based there in that building. I mean, just walk down the hallway. Many other, I don't mean to leave stuff out there. Domestic violence has a footprint there. Other services, PT has a footprint there. PT matters for trauma. Movement, yoga, hydration. You know, it's almost an emoji to have little oranges or mandarins, and for us here, but it is real, but it's also a symbol and a reminder, I should say. We try to, and I need to say, we're trying to TBR our organization. That's in my notes. I've kind of torn up my, you know, people talk about, well, I'm going to tear this speech up, and here it is. Well, I kind of am. I did and usually do. I'm hard to corral that way, but we're trying to TBR our organization. We have a champions team who's been working together for, I don't know, going on toward 1 year, from around the state, coming together. They do a little synchronous stuff and then virtual, but they're together pretty regularly and in person and talking about TBR, because we met with some TBRI folks and we want to be able to give it away, you know, provide this trust-based relational intervention care for children who come from hard places, yada, yada, yada. And their leadership is like, we know this organization. You guys need to TBRI yourselves. And we took that to heart and have rolled that out. TBRI is part of our business plan for 2026. It is built in there with all of these other operational things. Again, there are people here who are incredibly knowledgeable. They are not the ones with the microphone and the camera pointing at them right now. Honest. But they've got all this operational stuff. Well, embedded within that and part of that operational aspiration, dream, and plan, attainable plan, because guess what? We can't write down stuff that we don't want to genuinely work to achieve. That ain't good. So, is that TBRI informed agency, and ultimately a state, and of course, again, behavioral health leading the way, or public health, LDH, really leading the way on that. And us following, because we're joined at the shoulders, at the hip with our partners at LDH, our great partners at LDH. I'm spending off 42% of our workforce here, DCFS, effective October 1st of this year, to mostly LDH and also to Workforce Commission, because of the braiding and this one door out and into. But we have to work together, and we've learned that. And this administration, you know, one team, one team, one team. I handed out a challenge coin today to someone in our HR department under our Office of Management and Finance, and they looked at me. I'm like, we're one department, and every piece of this department matters. Well, we're one state government, and every piece of this government matters. And we have a leadership that they don't lean into it, they plow into that. So I want to give credit for that because it matters. And if you think you can solve trauma without Medicaid understanding and agility, or deal with child welfare without talking about placement issues and wraparound services to provide for fostering's hard enough. Bio-parenting is hard enough. And certainly dealing with children from hard places, oftentimes of the caregivers not their own making. But regardless, it takes that network of trauma-informed services that under that umbrella of health. But because health is a broad thing, and little seemingly silly things that aren't silly, yoga, movement, taekwondo, pick something. That discipline, that one of the therapies that people don't think about as being a therapy, I can tell you, for some people, mowing their yard is a therapy. I mean, maybe with a zero turn, but y'all know, folks, I certainly do, that it is. People talk about shopping therapy, but I don't get that. I would take issue with that, but I'm just one person. Is there a way for me to address questions or comments or others that can spin off of this smarter than I am? We got 87 people. I'm pretty sure about 85 of them.
Yeah, we have some questions for you if you want to start answering them.
I'd love
Secretary
to.
Matlock. Okay.
I would ask.
So we have one person that asked, how often have you seen youth involved with DCFS also become involved in delinquency? And what do you believe are the main mechanisms or pathways that contribute to that crossover?
Trauma. Yes, I mean, there's a huge overlay. The overlay, you go into the assistant principal in charge of discipline. You can go into and certainly go into child welfare and juvenile justice, and there's a huge overlay, and you can roll that back generation by generation by generation. And it was not unusual for me as a judge to have a child who was FINS, delinquent, and needed care all at the same time. And maybe child support. I could probably, if I thought about it a minute, come up with that. But and child support is underrated because parenting and collaborative parenting and utilization of resources is significant. High school degrees matter. Trade education matters. Marriage matters. And employment matters for outcomes. And childhood trauma affects all those things. And then health, chronic disease, cancer, heart, all those other things. Just roll out the timeline a little further. Yes. But again, go to Angola, go to your local sheriff's jail. I do want to say Shreveport has done an amazing job of this. And again, Volunteers for Youth Justice, Lucinda Miles in particular, they take every week, they go into the sheriff's adult jail in Caddo Parish and take TBRI training and I've seen classes of 90 inmates there, all holding up their hand, showing what happens when you flip your lid. And I didn't talk about it. I just assume most folks on this call probably have some knowledge and most a whole lot more than I do about cortisol and the effects of the brain chemicals and our neurological reactions to stress and all of the toll on that and how that manifests itself in emotional health, job performance, all these other things. The best time we can have is tell people take some time off. Take a break during the day, walk around the building. I do it outside. Get a snack, all those things. If you want to enhance productivity and but also health, happiness, attrition, all of those other things. So yes, there's a huge overlay to it, and working to have people say, well, children who age out of foster care have, huge numbers ending up. And that is a huge thing. And we watch it. I watch it. We look at it and try to address it. The Senator Ryan, from Bossier, former senator, led to this youth aging out, the adding stipends. Ryan Gaddy, thank you. I'm so embarrassed. I hope he's not on here, but he's a hero for that. Obviously, and arguably paid a political price for that. But that's I love everybody, right? Working with children who have aged out, and we have stipends for that, and lean into that work. Shannon Catanzara with our agency particularly heads up that body of work. I'm deeply involved in it. And we see those effects, but that's a voluntary program, as it should be. The child's 18. We certainly try to encourage it, and many children use that, benefit from that. But it's tough. It is tough. And the depth of what children, it matters what happens to us and what has happened to us. Wholesome parenting and addressing through, again, evidence-based responses is key, because understanding this is not an excuse for problems. It's a pathway, a roadmap to get out, to emerge, to break generational cycles and be successful. And most do. Most do. And we have to rally together to support foster parents, because you can't always return a child to their parents. And having folks who are willing to step into that gap and have resources supporting them, and people who encourage and care for and help them, and we're doing a lot of things internally, rate setting and many other sort of streamlining of processes and things, but it takes a minute. Working very hard at it. But it does take a minute, and that's frustrating. It's frustrating for those of us doing it, among others. So, great question. There's a huge correlation. I would suggest foster care is not the cause. It's just an adjacent correlate.
We have another question that asks, how does Secretary Greenstein feel about this work? We haven't heard about his views / support.
Well, I think you're seeing it through Gwen, through Christine, through Karen Stubbs, through the fact that they have picked this work up and continued it. This work was ushered in under a prior administration. And I think the fact of the continuity here speaks volumes to Secretary Greenstein, and more so to our governor, because, and obviously I love both, work for one of them, but that decision was made well back. We're moving forward with this work, and it's economically makes so much sense. If you want to save medical costs, this is how you do it. I did want to roll back and just emphasize that training. And that we're talking, they learn about endocrines and cortisol and all those things in the adult jail. And this presumption that, that I felt like sort of was out there maybe, but not expressed, that the professionals need this, the teachers, law enforcement, judges, lawyers, medical folks, they need this, but the parents, they can't get this. They're not going to understand about childhood development, the frontal lobe and all this stuff. They absolutely understand it. They lived it. And that's that big thing that goes on in that jail. They're a captive audience. They love it. It's something to do, but it's also so enlightening. It's like, wait a minute, I'm here because I got a kid. This is me. That happened to me. That's why I'm sitting here. It's like you get this sense of self-forgiveness and seeing a way forward. And they've had folks come out, get out of jail, put on suits, come back in, go off, get practitioner training, and come back in and lead this in the jail. Hey, Bubba, I made up a name, but it's powerful to watch and meaningful and effective and bang for the buck. As far as I know, the state's not paying much for that. There's probably some VOCA funding rolled in somewhere or whatever, but braided community-based dollars and other things, and just really good people doing the right things for the right reasons. Well, that needs to be, whoever in Bogalusa, Tangi, or Calcasieu say, I want some of that. Sheriff, going up there, that sheriff, Steve Prater, now Sheriff Whitehorn in Caddo, they get it. They love it. It's not just good for those inmates. Guess who else it's good for? You know who else is locked up every day? The best part of those days, of course, the jailers. And then that relational stuff there and the understanding of the whys behind the behaviors, it's transformative. It was for me. They called me Judge Padlock. And I, probably still would be, but not in this body of work. So other questions, Quinn?
Yes. We have, what is happening with Medicaid funding for programs that have shown effective evidence-based care? Our reimbursements have been left at the 2012 rate, for example, home builders. This provides barriers to provision. This is a CSOC option.
CSOC option for referring to wraparound, I'm sure there. As an agency, we have leaned into some intercept and some other work, but as a model, we are trying to recognize the importance of Medicaid. And I think the leaders within LDH understand, and let me just say there's some significant efforts going on around waivers, around particularly as it intersects with foster care, and the importance of recognizing that children coming out of child welfare, not just foster care, child welfare, are a special population. If you've had a validated event, that's a special population, and that sort of self-identifies. Now that's not exclusive by any means, but it does. It's one more flag into raise your hand and say, look here, I need something. And so some work there. I doubt anybody feels like we're overfunding evidence-based supports, and I certainly believe in these things. And there are other ways to do it by subsidizing the credentialing process through other public and private dollars. Go help your LPCs get credentialed in EMDR or TFCBT, or pick narrative, prolonged exposure, whatever. Pick something that's validated. The clearinghouses are fairly clear. SAMHSA and California Clearinghouse and others will tell you what seems to be scientifically supported today, evidence-based, relatively predictable and positive outcomes. And let's lean into that. I want to stay in my lane as to that response, Quinn. I do know that I advocate for that. And I would say Office of Behavioral Health through partnering with Dr. Philippi, Stephen Philippi, and the Center for Evidence to Practice, have done that very thing by subsidizing and bringing up the entire quality of service. And that's something Norman Elrod's looking at in East Baton Rouge, and that crew. I'm using him in a sort of a collective Borg type way. But and that was certainly done by the folks up in Northwest Louisiana, Shreveport, Caddo Parish area, Laura Alderman and many others working with those mental health professionals up there to subsidize the level of their care, particularly those that were saying we're willing to work with this Medicaid funded group. The rates, I would tell you, that's a conversation with Karen Stubbs, and in terms of behavioral health, others with physical health, but it is, I think that when you're talking about these areas, and CSOC's not limited to, quote, those narrow fences of behavioral health. They will look at housing and, transportation and many other hurdles to well-being on that. But it needs to be done smart, because we don't have too many resources, and we have to use the resources that we're given as best we can. I don't have taxing authority, and nor would I want it, to be honest with you. Maybe the real answer to that is a little over my pay grade and a little out of my lane. I'm certainly an advocate for good services that are available to high needs people.
We have another question that says, we know that to become truly trauma-informed takes an investment of time. How do you convince professionals and particularly leaders who can grant their employees the time, the value of prioritizing multiple days of training needed to integrate a trauma-informed approach? We have encountered that more and more people get it and don't necessarily doubt the importance, but in practice, they can't set aside the necessary time in today's world.
So I'm going to take that question at two levels. One is at the individual level, and two is at I'll call it the boss level, the business owner, the operator person. It is time well spent, and you will have better outcomes in the work you do. And I don't care if you're running an assembly line. If you help your people understand trauma and live their lives, where on their way home and they get in their driveway, they stop for 5 minutes and, hold under the seat of their car or just clear their minds. Healthy practices, there's 1,000 different things. Some people lay on the floor during the office day, real grounding. Probably would lay in the grass if they had the opportunity there, and relax for 5 minutes during the day. You will be more productive. And I think people who operate businesses understand that at a fundamental common sense deal. Now, investing the length of time it takes to put into this, it just takes the willingness to deferred gratification. You can produce 15 widgets today, or you can drop that to 10 widgets today and produce 30 widgets tomorrow and the day after and the day after. And, we talked about we medical professionals, mental health, behavioral folks talk about deferred gratification, the importance of that in healthy outcomes of life. I don't think it's a hard sell. I think facts matter, and gathering the data, blanco center, blanco center, blanco center, gather the data. That was where this was a brilliant business plan. As far as I'm concerned, you spent a year and will continue to spend time. That's what they do. Whoever envisioned that, and it wasn't me because I'm too impatient, but it was smart, and I applaud it. So I don't know if that was a lob from Blanco of the question. I don't think so. But informing the public of the impact, just like you're informing those parents about what happens when they engage in physical violence in front of their 2-year-old or 6-year-old child, and how that impacts that child, I can tell you people don't realize that till you talk about it. And they hear somebody next to them say, yeah, that was me. Yeah. And the anger that causes internally and how that manifests itself in stress and life and frustration and, bad behaviors. But I think facts and encouragement to engage in that remarkable and rare trait called delayed gratification is a thought. It's my professional oil and gas law opinion and I'm not qualified to practice in that area anymore. That was 40 years ago. So.
We have another question that asked, how can local school districts help support children and families who have experienced trauma? What resources are available to them that may not have been effectively leveraged or communicated to them?
That's a brilliant question. The real answer is call Casey Monero with the Caddo Parish School System and address her. I forget the overarching name, but it's the Trauma Responsive Schools Plan. And they've invested some hundreds and hundreds of thousands of dollars in educating teachers in ACEs education, TBRI, caregiving. They used ACEs and TBRI and still do. Casey Monero, who is the supervisor of child well-being for the Caddo Parish School System, who offices in the harbor, which is operated by Volunteers for Youth Justice and is the one-stop shop I talked about earlier, along with their 504 section and other child wellness groups there, the school psychologist and 504 and all their officing there. That's a collaboration. That's a silo that got beat down with a sledgehammer. So I mean, I can talk about the details of it, but they braided it in. They developed a plan, talked to a bunch of folks, submitted as part of their state plan, probably got some special federal dollars coming through at the time. I probably don't get them anymore, but don't really need them. You just got to have the leadership and the mindset to do that, and teach your educators about it. But go to University Elementary School, which Casey was the principal of. She had the first calming studio in Caddo Parish. Now a number of schools there have calming studios. I forget what the number is. Like, I don't know, it was 5 when I left, and it's like 11 or 19 or something now. I'm not sure where you draw the lines, but it's a remarkable work where you got people who understand this sort of mental impact of trauma and stress and the need to take a break. And not every child who's dysregulated needs to go to be put in school suspension or sent home. Maybe they need a Pop-Tart, not a Pop-Tart, orange, whatever, bottle of water, conversation, sit on a bouncy ball, put on a weighted blanket. That's a different lunch and learn, but there are 1,000 things. It's a great question. And that's what drove me to it. I had foster parents standing up, and this was 5 years ago or more, probably well before, maybe 9 years ago, standing up in large meetings saying, I can handle the meltdowns at home. It's the phone calls from school every day that are driving me crazy. Please take this to the schools. And guess what? We did. And it wasn't just for the benefit of those children and those foster parents. The transformative impact across Caddo Parish school system has been remarkable. And it's documented. And, here's our plan. Here's what we do. Here's how we do it. Here's how we fund it. But it's not really a financial problem. It's a leadership problem. I'm just going to. And a communication problem. I'll accept my role of the lack of leadership. I'm responsible for that. A positional leadership, but I'm trying. So, but again, local. Sit down with your superintendent, send them a video. Bring in a TBRI instructor. We got free TBRI Fridays. Sit with us. And that's how we did it. It was one-on-one relationship. Me, so-and-so sitting down with Dr. Keith Burton, who at that time was in charge of something that wasn't really quite related to this, but cared. And now he's superintendent of the schools and there. And so, but it was very relational, very local, one-on-one. Lunch, feed folks. There was a question earlier, how do you get employers to buy into that? Buy them lunch. Bring in somebody who knows something about what they're talking about. Not me, but there are people who really can talk about ACEs. All these ACEs instructors. We have ACEs instructors around the state now. Y'all are leaning into that. Our amazing Department of Health and Office of Public Health. We've got crisis intervention for children now, and it doesn't take much to trigger that, and it's Medicaid funded. Any child from my world, any child who is moving into a foster home or moving from one foster placement to another automatically triggers the eligibility for that, and it triggers other resources, some of them physical resources, not just counseling and, hey, how can we help you? But it's like, here's a car seat. Now, that's an example. I'm not sure it's applicable, but it's like that. So there are caseworkers with every, certainly the ones I know about, Lafayette, Shreveport, others. There are caseworkers who handle with the local parish health offices that do casework, wraparound casework, social work, pure D social work. That's communication, networking, and silos right there. I didn't learn that till embarrassingly recently, that the so-and-so, I would not want Maria and Shreveport to be mad at me. There are others around the state. I'm teasing. That's their work. That's their life's work, social work. Just what we're talking about. Access to services, get them into this stuff. But the crisis intervention is a great pathway to that. Seaside, good pathway. Other questions, Gwen?
Yes, before I move on, I do want to say that Casey Monero put her contact information in the chat. And we do have the chat open. So if you guys have any comments, please do, you can leave them in the chat for us to read. And also, I do want to say that Casey Monero will be having a Lunch and Learn presentation with us. So if you're interested in her work and what she is doing with the schools, please do check that out. Yeah. So we have about 3 minutes left, and I know we have a bunch of questions. And oh wait, hold on. Someone raised their hand. Go ahead if you have a question, John. Or not.
Do email me if there's questions that we don't get to, and I'm sorry, I've talked too much. That's predictable.
So I'm gonna go ahead and start. We're gonna finish out some of these questions. And I'll quickly announce that make sure you complete the post survey at the end of this, especially if you're getting CEU credits. And even if you're not getting CEU credits, it would be really helpful if you still filled out that survey. That will help us improve our future webinars. With that being said, I'll go ahead and field the next question. Let's see, this one says, I appreciate the comments about evidence-based practices and noting them in relation to foster care. Are there any particular evidence-based models that DCFS is increasing access to for youth in foster care?
It's not uncommon at all for me to talk about TFCBT, FFT, CWT even, EMDRs, evidence-based for both adults and children. I talk about them, but I'm not qualified. Be kind in your comments, by the way. If I sound like a know-it-all, I am not, and I know I'm not. I care a lot. I don't know a lot, and so I do get excited about it, and that's hard to watch sometimes. But we do, but a lot of that work is done. That's a great question, actually. I don't think we do enough. I don't think we're working it through case management, and I certainly do it, but through this work, trying to build it up locally. And that's sort of how I got to meet Norman and some other folks here, amazing folks, Charmony and others in East Baton Rouge, is you got to do it locally, build it up, try to get folks, and the willing are out there. We just got to bring the willing together, and it's got to be done one community at a time. And you got to have a leader to do that. So I tell judges, doctors, therapists, it's on you or us to do that. You don't have to have a robe. It helps, but it's not required. A great teacher, a Casey Monero, a Kelly Todd, a George Mills, a Norman, find Ashley Carey Betts in Orleans and Gretna. I mean, there's people around who you got to look for them locally. LDH can try to connect you. I can try to connect you.
Okay, so I know it's at 1, so if you do have to hop off, please feel free to do so. But we're gonna quickly answer the last couple of questions before we end for today, if that's okay with you, Secretary Matlock and
Yes.
Yes. Okay.
Yes.
All right. So one question we have is that serving children and families can be rewarding, but also very taxing, often leading workers to burn out. What are your plans and current strategies implemented to address burnout within the agency?
We are in the process of hiring, I think, 53 additional CPS workers, for example. Some of the organizational changing, updating. That's again a great question, and but it really has to do with professionalism in the technology, the systems and processes, and the things that we use, the equipment that we use, and the people. And it's a bunch of things being done at the same time. It's adding legs to a stool, and you got to kind of add them all. Onboarding, training, recruiting. Training is huge. We've had changes in leadership. We've fired people, demoted people, changed, moved, reorganized, restructured. We're our business plan or plan is about to be rolled out. I don't want to be overly detailed about it, but it involves multiple legs on a stool. And honestly, simplifying some technology. You don't have to have big mainframes that take 20 years to develop and are immediately outdated 10 years before they're finished. Apps. And so leaning into some of those type things and simplifying some processes, both our billing for vendors. We're moving toward performance-based contracts as opposed to how many paper clips and how many hours, how many kids, what are your outcomes? Here's the money. And don't send me stuff that takes you 30% of your time under this contract just to generate the bills, and me 30% of the time to go through and validate them, do it. Just simplify that. But that's also true at the foster parent level, and we're working on rate setting for across our service array, from therapeutic foster homes, 1, 2, and 3 levels. We've added a level and increased numbers, working with partners, but also just our regular foster care. We're in the process of, we've got teams working literally today to outside to set rates so that if, with appropriate parameters, if you're treating a newborn, then we don't need to know about every diaper. We need to pay you more and make it simpler. Now, if it's not routine stuff, then we need to have a way of documenting that and still not requiring you to do it. If the child's on a PEC tube, it's going to be X, and whatever. Trying to be simplifying that, and that ranges through the onboarding process, the qualification process. We're at an embarrassing length of time to onboard somebody from "Hi, my name is Jane" to "Here is your child," that we want you to care for tonight. That process has been very, very lengthy, and fostering does not require perfection. And our goal is to take good care of children, not to stay out of trouble. And so helping that mindset and the cultural change involved in that mindset is extremely important. Because guess what? If you do that, you stay out of trouble. The harder you try to hit a golf ball, the wilder it goes. And so there's a bit of that. But we're rate setting and some other things that is another conversation, I suppose, certainly at this late time for this meeting. Love to talk about it, though.
So this question I'm also very curious about. So it's it said, given the significant Medicaid and SNAP cuts in the One Big Beautiful Bill, along with increased administrative hurdles, how is DCFS preparing to protect the health, safety, and well-being of vulnerable children in Louisiana, especially those in low-income families or in foster care in the next year or even over the next decade?
So Medicaid, if I'm understanding it right, and it's a little bit out of my lane, I am following it, but is putting in work requirements for able-bodied people who don't have a child of a certain age that they're having to care for, or another invalid in the home. And so having able-bodied people go to work and having more people pulling the wagon than in the wagon can be a little, at least at that sort of global level, can be a little hard to argue with. Cuts to Medicaid, I think, as I understand it, it's really just workforce requirements, which is one of the wonderful, elegant things about we were going into this one door. SNAP already has work requirements in it. And that body of SNAP eligibility work was being done by DCFS. LDH was doing Medicaid, which has no work requirements in it. And we're moving October 1st, moving our SNAP eligibility with all these amazing people that have expertise in administering work requirements together with the eligibility for Medicaid, where we've got that body of knowledge coming together with what is, we, as a state, Louisiana, you can call it foresight, you can call it fortune or blessing, but we're ahead of the curve with that by bringing those two bodies together under LDH to be prepared for the workforce. The cuts on SNAP, Louisiana actually we are 12th in accuracy of SNAP benefit determinations. The penalties coming in on SNAP, for the most part, the big penalties, the 100 million, the tens and tens or scores of millions of dollar penalties come in because of a lack of accuracy. Well, we're 12th in the country in accuracy. We're good in accuracy. And that's what they're penalized. They're going to penalize people who aren't. There are people who are many orders of magnitude worse than us, states. They're trying to get waivers and do stuff. Well, we're up here in the top 12. So that's for what I call the commodity. It's not the right word, but it's that having to pay for the food, so to speak, or the benefit portion, what actually gets in on the EBT card to someone. If you have to pay 5% of that or 10% of that, that's a bank breaker for a state. And so, or 15% of that how much we're paying in SNAP. And so Louisiana is well positioned. It's not perfect. There's room for improvement. And I'm confident my colleague, Secretary Greenstein, will do a great job with that. It's hard. It's a heavy lift. That's why we're 12th. And y'all, I mean, we're not a resource-rich state, although we really are. Everybody knows we've got more resources than any other state, starting with our people, but certainly our natural resources. So we're as well positioned, as we can be, trying to be. So the shifting of the administrative costs in SNAP, we'll have to see how that plays out. And honestly, I'll plead age. I have to look at that fairly regularly because we're doing a lot, and I do watch it, but I need to be careful where I spout about that administrative cost portion of it. But we're good at that. And it's hurricane season. We're running, we're preparing for, y'all be careful with the weather. We've been watching it very, very closely the last few days and week and two, actually for a month, coming off of Africa and headed our way. So, and ocean temperatures and things. But that's all trauma too. And being able to braid trauma in with those mass shelters and even non-mass shelters, because those have children. And that's not a captive audience, but it's a ripe audience. The kind of folks who need that and are at a position in their life and certainly have just been through a major trauma is important work. And LDH and DCFS, we're on different wings of the same shelters. I mean, they doing medically related work. We're doing sheltering work, but we're working hand in glove. Same kitchens, same quarters for staff and others.
Thank you, Secretary Matlock, for answering all of our questions and also for your presentation today. I hope everyone has learned a lot from his talk today. That was our last question. I know we're way over time, but I wanted to make sure that everyone's questions were being answered. So again, thank you everyone for coming. And please let us know if you have any questions or if you have any questions for Secretary Matlock. His information is in the chat. So thank you again, everyone, for coming.
Thank you, Lisa.